As I was giving my dad a kiss the other day, he said, "Buddy, your breath is really stinky. You need to have your teeth cleaned." Next thing I know, I was headed to the Animal Hospital of Waynesville to see my favorite veterinarian, Kristen Hammett. When we got to the hospital, Dad checked in with the client services girls. They're always so nice. Dr. Hammett met with us and discussed the whole procedure with Dad to make sure he did not have any questions about the procedure or the cost. Once Dad left, the nice doctor took me to the really sweet girls in the treatment area. They drew a small blood sample from me. They said this was to make sure my kidneys and liver were healthy and could handle the anesthesia. I was then given what the technician called a pre-med, and within minutes was feeling really good and feeling no stress. Next was the IV catheter placement, but it was no big deal because they had numbed my leg ahead of time. I just got a big hug from one of the girls and calming words. "Buddy's such a good boy. Such a good boy." They told my dad the catheter and fluids were really important because it kept my blood pressure up during anesthesia, helped keep me hydrated, and provided vein access if there was an emergency. All I know is it was safer for me. Did you know at my vet hospital that only a registered veterinary technician or a doctor is allowed to calculate my anesthetic medications, induce the patients, and place the endotracheal tubes? This is a big deal because not all hospitals require this. These girls went to school for this and were trained, so I feel so much better knowing they were taking care of me. After the IV medication was given to me in my IV catheter, the endotracheal tube was placed into my windpipe to keep my lungs free of water and debris from my mouth while my teeth were cleaned. It also allowed the technician to give me big breaths so I had enough oxygen while asleep. It also provided me with sevoflurane. If you don't know what that is, it's a gas anesthetic that is the best, and it's used in humans and children. Once I was under anesthesia, I was hooked up to this machine called an advisor. It was really cool because the girls monitored my heart rate, respiratory rate, oxygen and carbon dioxide levels, blood pressure, and temperature the whole time I was under anesthesia. While I was sleeping, I was laying on a warm water circulating blanket and covered with blankets to help keep my temperature regulated. I can't do that very well by myself while I'm under anesthesia. The doctor and technician charted my teeth and made notes about each of my teeth. Dental x-rays were taken to look at my teeth below the gum lines. You know, without x-rays, the doctor could miss 70 to 80% of my tooth. Then, the technician stained my teeth with this cool pink stuff that showed them where all the tartar and calculus was. The tech then removed the calculus from my teeth with something they call a calculus remover. Go figure. Scaled my teeth with this cool machine called an ultrasonic scaler and polished my teeth. Polishing is a huge step because it smooths out all the grooves so bacteria does not have a place to settle. The last step they did was apply something called Oravet to my teeth. Oravet is a dental sealant that slows the plaque bacteria from getting on my teeth again. I woke up in this nice, warm, cozy bed with all my friends around me. And the best part, my teeth felt so smooth and clean, and I could not wait to go home and give my dad a big kiss. That same afternoon, my dad came to pick me up and did a discharge with Dr. Hammett. She showed him all my cool pictures and x-rays. The best part was in 2 weeks, I got to come back to the hospital to visit my friends again for a dental recheck, and the technician gave my dad a goodie bag with lots of treats, toothbrush, and yummy doggy toothpaste in it. It was totally awesome.